Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are in the preparation of putting together a brand new lecture pack, which is titled Translating Knowledge into Practice, Creating Effective Lactation Care Plans. And here with me today is Dr. Patricia Diaz. Welcome, Dr. Diaz.
Thank you so much, Kristen. How are you?
Good. I'm very well. How are you doing?
We're doing fine. Thanks.
Wonderful to have you here today. I know you have a very busy practice where you are. So tell our listeners, first of all, where in the world are you?
I'm currently in Caracas, Venezuela, where I
Mhm.
practice as a pediatrician, an IBCLC, and a doula.
Oh, wonderful. So, oh my goodness, a wonderful combination. Pediatrician, lactation professional, IBCLC, and doula. That's like the complete package here. We need to clone you and put you all over the world.
I
That's
get
the
that a lot.
that is the ideal combination here. That's fantastic. So you, as you said, you're pediatrician, doula, and IBCLC. Tell us a little bit about your background. How did you, what were you first, a pediatrician or a doula, or how did this all come together?
Well, first of all, I've started as a surgeon physician and then a pediatrician. And during my residency, I discovered the wonderful world of lactation. And I
Ah,
never looked back. I fell in love with lactation, with breastfeeding families, chest feeding families, and it has been a journey. And I'm so motivated to bring that knowledge into my private practice as a pediatrician, because as you said, sometimes we as physicians have like very reductionist views of the patient and of the breastfeeding family, and
mhm.
it's a whole wide world that you have to integrate. So
Yeah.
it's really nice to be able to do it.
To integrate that. And yeah, correct me if I'm wrong. I hear this a lot from physicians and also from some nurses that they are shocked and surprised how little they knew about breastfeeding in their education. So how is it where you were educated, when you went to medical school? You said you found the love for lactation in your residency. Was there a lot of education on the subject, or did you find the love and then dug deep into it yourself?
Well, actually, I took my residency at the main pediatrics hospital here in Caracas, Venezuela, and they had a special program there, which is called Mi Gota de Leche, a drop of milk. And
Mm.
then I found my first and foremost teacher, Doctora Evelyn Niño, who like brought me to this world of breastfeeding families, and it was wonderful to find out. First of all, that we know very little about how lactation works, how it integrates as a pediatrician in
Mhm.
everything. Right now, actually, I was talking to my students yesterday, my pediatric students, and I was telling them, listen, guys, we have to integrate all this knowledge. It's not
Yeah.
just a human lactation unit. It
Mhm.
has to do with everything that you're going to do in all your residency. So it's like a global vision of child and mother care. So it's really important to integrate that.
Fantastic. I love hearing you speak like that because you're so passionate, and I can really see how this is you passing it on to your students to see it in a holistic view, especially as pediatrician. That's
Yeah.
the nutrition for the baby from, it's right there and so important. So I'm glad you are spreading the word and the knowledge and passing it on also to your students there. That's fantastic. Now, I would like to talk a little bit about the presentation that you have with us here at Gold, and it's titled Breastfeeding Beyond All Obstacles, Breastfeeding Families and Complicated Mastitis. So tell us a little bit about this. Mastitis, a huge topic, we hear that a lot from our patients and families. It's one of the things that is like this black cloud, it's there and we know, oh, when is it going to come and what can we do to prevent it? So tell us a little about this presentation.
Yes, this is a presentation that I wanted to give because there's a lot of lack of knowledge
Mhm.
in patients and as well as at health providers about how to manage this situation without losing a breastfeeding history. So this is very cardinal and very important, and it's one of the main obstacles that may arise along the way,
Yeah.
especially in modern Western societies. So whenever an obstacle presents itself, it's like, okay, breastfeeding is done. We're abandoning this, and
Hmm.
let's move to another topic. And we need to speak more about this. We need to teach this to students, to health providers in every care of attention level, because it's really important.
Absolutely. And you brought up a very good point there. When we're dealing with mastitis, it's interesting because, we have the breastfeeding diet, we have this, mother baby unit there. And all of a sudden, when we have mastitis, and maybe this is just something I'm seeing in my area here, all of a sudden, when we see mastitis, it's all of a sudden the focus is away from the diet and we're focusing on the mother. and
Yes,
and then
totally.
breastfeeding becomes like, okay, this is, let's not deal with this, we need to focus on fixing mastitis first and fixing the mother. um and it's so sad because I feel like, and this is what we're going to learn in your presentation, there is so much we can do to kind of look at the diet and of the breastfeeding diet, and treat this and keep breastfeeding going, and help the family that way as well.
Exactly, Christian. You brought up that, like, the main issue is that we need to address every situation simultaneously. We
Hmm.
cannot have like a reductionist point of
Hmm.
view and look at mother, look at the mastitis, and look at the baby,
Yeah,
because you have to address every issue
everything.
at
Yeah,
the same time, because lactation is not expendable, which is
right.
like a mind frame that most health providers have. Like, okay, well,
Uh,
we're done
yeah.
with this, and let's move
Hmm.
to another topic. Yeah.
Right, right. And where it gets complicated is that every diet, of course, is different. Every case of mastitis is different, right? And, every family is different. And then on top of that, also what these families bring as knowledge with them into the situation. Maybe they have seen from friends or family or their sisters or mothers, that, oh, when once they have mastitis, they had to abandon breastfeeding. So they have that in their head that's what they have to do. So there's also quite a bit of education that we need to do with the clients as well, with the families, right?
Of course, education is key. Education of a family or someone who's coming or becoming a family. And you need to address this from the gestation point of
Mm-hmm.
view, and then when baby comes, because you don't have to wait till the baby's here
Yeah.
to know or
Yes.
learn rapidly or with a lot of error what we're going to do. So this is key. It's a key point. Breastfeeding culture in our societies, to normalize or visualize what it's normal, what is expected of our species. So that
Yeah.
is a main issue.
Oh, I love what you just said. It's normal what is expected of our species. I love this. This is so true. And when you say it like this, it becomes like, yeah, this is what we need to do. This is normal. This is what we need to do here as well. And you're so right. Education, not just when the problem arises, but right in, when during pregnancy, in the prenatal classes, we're teaching problems that could arise postpartum. And yes, we mention it, but we really kind of just brush on it. We don't want to talk too much about the negative. Yeah, we have to address it. We need to kind of, so they are prepared, but we don't want to dwell on it too much, and maybe it doesn't affect them. But we need to find a way how we can address this prenatally, so it's not something scary, but not something that we just brush aside, but like something that they know, okay, if that comes, we are prepared, we can do something. Let's tackle it together as a care team with the client together.
Yeah, I totally agree with you.
Okay, wonderful. Before I let you go, I really look forward to this presentation here. But before I let you go, what little nugget of advice or wisdom do you have for our viewers here?
Well, I think I always speak about breastfeeding culture in our societies, in our modern societies, because sometimes, and even though this is an ancestral behavior of a species,
Mhm.
we kind of forget, or we don't have that organic memory how to do it and what to expect. And sometimes we think that whatever is happening in our family, in our home, it's different from whatever is happening in everyone's home.
Mm.
So this is so important to build a very strong net of support with clinical based, evidence based lactation information for these families, so they can succeed in their breastfeeding goals.
Wonderful. Well, thank you so much, Dr. Patricia Diaz, for spending time here with me, talking about the wonderful work you're doing in your field there in Venezuela, and also about the upcoming presentation here.
Thank you, Kristen.
And for our viewers now, if you would like to find out more about this presentation and the other wonderful presentations in this amazing lecture pack, we would like to invite you to go to goldlactation.com and goldlearning.com. Thank you everyone for watching. Bye-bye.